Bowel bladder disorder is an frequently unrecognized entity. Basically, a child presenting with frequency, urgency, hesitancy, pain, arch incontinence, and Vincent's courtesy sign, cross leg bending forward, and squatting with heel in perineum to stop defecation or micturition, and you're pinching the glands, constipation, and copiasis, and plenty of other issues of voiding disorders and rectal evacuation. So they are important in the management of plenty of diseases. And like also those the presentation, maybe overactive bladder, underactive bladder, no, your dysfunctional voiding disorders and neuropathic bladder and so forth. So thereby they need to be identified and to be treated. The first investigation may be the ultrasound of the lower urinary tract bladder with mean cystic capacity and postpartal residue, whether urine is collecting over there, and urinary tract infection exclusion, and then it also psychiatric assessment. Developmental disorders, they are more common in the obese person, so they are to be looked upon. Finally, very rarely you need to do a neurodynamic study. And neuropathic bladder, those are the cases where you need to do one, spinal MRI and the brain to be looked upon for Arnold Chiari malformation also. So, how to treat the bowel bladder dysfunction? Urotherapy, 4 to 7 watts daily at the interval of 2 to 4 hours is the standard. We call it timed voiding, double voiding, and adequate time to void. So these are the ways that you can reduce the amount of symptom, and adequate fluid intake is must. Caffeine load reduction can be useful good amount of time. Pelvic floor exercise, Kieselbach exercise, and your conditioning, morning time, definite time, bowel evacuation, use of laxative, behavioral modifications, and some drugs, like the overactive bladder, you can use anticholinergic like oxybutynin and tolterodine, mirabegron. And dysfunctional voiding, you can use prazosin, tamsuline, and tarazosin. Underactive bladder, in severe cases, you need to use CIC. Refractory cases, the botulinum injection, and your nerve stimulation, like therapy might be needed.